Welcome to this AbleNet webinar. I am Padmaja Sarathy, and the topic today is personalized behavior supports for preschool children with autism spectrum disorders. For the sake of brevity, I might just use the term autism or ASD, the acronym, but I just do want to say Autism Spectrum Disorder is a spectrum disorder because it covers a wide range of characteristics. And welcome to this webinar, and I want to begin with thanking AbleNet for organizing this webinar. And I feel particularly delighted that I have this opportunity to share this webinar with you all, especially this month. This is April is Autism Awareness Month. Let us work together and to enhance the quality of life for children with autism spectrum disorders. Let us try to personalize the intervention and the supports so that we can learn to celebrate and identify and name their strengths. And these children with autism, do have specific preferences. Let us name and identify those preferences and finally celebrate their achievements, whether it be big or small. With that beginning, let me go ahead and share with you what would be the focus. Children with autism spectrum disorders have a wide variety of characteristics. But somehow the one characteristic that often causes some issues for educators as well as families is some of their problem behaviors, the challenging behaviors. So today in this webinar, I'm going to present a variety of case scenarios where the problems, situations are experienced, most of them by educators, and how to respond to those challenging behaviors. What preventive strategies can we put in place? How can we structure the environment? And how can we use interventions that are personalized for the child as well as for the environment? So that's going to be the focus, and most of these situations, problem situations that I'm going to be present is based on my own experience with visiting classrooms and providing workshops, face-to-face workshops for educators. So these are all real-life scenarios. What kind of experience and expertise do I bring to this webinar? I'm an educational consultant and an author of a number of books, quite a few products focusing on autism. The first title that you see, Positive Behavior Strategies for Students with ASD. I have just recently, about a year ago, I updated the book and it is sold through LRP. I also have a quick laminated guide on autism spectrum disorders, 7 steps of support. And today I will share with you a lot of the information from these 2 sources, as well as from a music CD that is to help children with autism making transitions. And in the next few months to come, I'm going to be doing some webinars for para-educators, but others are quite welcome, so that if there are teachers, they can train, or if there are coordinators or special ed supervisors, they can train the para-educators. And one of those units in that book and DVD training unit focuses on autism, because children with autism have kind of unusual characteristics which we haven't fully grasped yet. So we are still constantly learning to address some of these problem behaviors. So these are some of the supports, and as I said, many of these resources are from LRP publications and NPR publications. I am currently working on a book on significant disabilities, IDEA and ESSA. And these are some pictures, and you can see them in your handout. I'm going to go ahead and start with a definition, the legal definition of autism spectrum disorders. In some of my previous webinars focusing on autism, I have in depth explained some of the characteristics of children with autism spectrum disorders. This one is just the legal definition. What does the IDEA say? That is the Individuals with Disabilities Education Act. It says children with autism, it's a developmental disability, and usually it is evident before the age of 3, and that's why I believe, and I'm sure most educators believe, that the intervention that takes place in the early childhood years, in the preschool years, can be the most effective and most rewarding for and most gainful for the child with autism. Autism significantly affects the verbal and the nonverbal communication and the social interactions of children with autism. So those are the areas of needs. Communication, even if they are verbal, they are not able to draw that verbal ability when they have a need to communicate. And one of the major areas that cause often behavior issues is their social interaction issues. And these two areas of need affect their educational performance. And also children with autism, many of you might have noticed that they engage in repetitive behaviors. Not that they are usually harmful, but if they are harmful to themselves or if they cause self-injury, then that is something that we need to address and teach replacement behaviors. One of the major challenges that often cause behavior challenges, behavior problems for children with autism is their resistance to change. Whether it is change in the environment, or change in the activity, or change in the location, or change in their routine that affects them, even if they are familiar with the routine. And they may also exhibit unusual responses to sensory experiences. Here I want to mention something that is not in the IDEA definition. Children with autism, this is a quote from somewhere, I don't know where I got this quote from, they can tell you what they're supposed to do, but they cannot actually do it. The information, they are able to repeat it, but that information went into their rote memory, but not into their meaningful memory, and that often causes issues in terms of behavior problems for children with autism. So what do I hear the most from educators and also from families is the frequent meltdown, that they just drop down and kick and cry and scream and have some issues. Not that all children experience that, but this is one of the most frequently reported problems. Why? Why and what? What causes? What contributes to this problem behavior? It's the child's response to their own autism. And the world is a demanding world. And they haven't quite figured out how to respond to that world. And then their desire for sameness, even if they have participated, for example, in circle time many days before, each time the circle time comes, it's kind of trauma for them. It's something new. It's kind of ambiguous. It's different. It's to them unpredictable. And so also another thing that I want to mention here, researchers are just identifying that children with autism have what are called executive function issues. So they don't have the cognitive flexibility to switch from one activity to another or one person to another, and that causes issues. And then all of this is further aggravated by how we as adults respond to that behavior. Either because we did not sometimes make advanced preparation, or sometimes we respond in a reactive mode rather than a reflective mode, or sometimes the environmental situations cause fear and anxiety for them. Most of you know this, and I'm familiar with it, transition from one activity to another, from one location to another, and one person to another causes anxiety for children with autism. And many children, very high percentage, about 80% of them have stress or anxiety disorder, because as changes bring ambiguity. And it means they have to stop what they were doing and switch to something else. And it means they have to take their attention that they were focusing on one, which itself was difficult in the first place. Now they have to switch focus to another activity. And frequently, this is what I have found from my experience, a visual schedule, which is absolutely a must for children who are experiencing problem behaviors, may not be present or may not be consistently used and may not be used in all settings and environments. And the other issue is when they have to wait for one activity is over and for the next activity to begin, that waiting time is difficult for them. And it's important for us to be aware of these things so that we can have advanced preparation for that. And we may not have prepared the child for the things to come, which will help prevent a lot of the behavior issues. So some of the questions that you want to ask yourself: do you have a lot of supports in place to prevent or reduce problem behaviors? Are you making advanced preparation to prevent the meltdowns? How are the adult responses to the behavior? Are we responding in a reactive mode and say, okay, that's it, you're going to time out, and responding in a kind of reactive mode because the child had a tantrum? Are we teaching new skills to the student? In addition to not reacting in a immediately corrective mode and trying to discipline the child, are we also teaching behaviors that will help the child to calm down and use future strategies that will help the child? One of the simplest and the easiest supports that we can provide, and it is also less intrusive, are visual supports and structural supports. So when you're setting up your classroom, make sure that we don't arrange the furniture in the periphery of the room, leaving open a very large middle space where the child can run back and forth. And many of them do have a tendency to run, those who have problem behaviors. So this is something very simple to arrange. So you arrange it in such a way that there is furniture that will prevent them. This is just a physical barrier. And the other thing is use pictured rule cards, simple ones that is personalized for the child, and put them in a key ring and take them with you wherever it is appropriate and needed. And you may have to have 2 or 3 of these rules depending on the environment. These pictured cue cards, I call them. And also in the classroom, do you have the rules posted paired with pictures? And some children who are very young may even need an object cue in addition to the picture cue. And one of the things that you can do is to place a talking brick, that picture that you see, next to that rule, and program it so that each time you want to remind the child about the rule, you can have the child press that button and hear the rule, at the same time see the rule. We are going to go ahead and begin with some case scenarios. what are some problem behaviors? How does it impact the child? What can we do to prevent these kind of situations? I do want to mention here is an example of a child with Mark who is very high functioning. Not all children with autism are high functioning. There is quite a wide variation among the academic level and the communication level of these children. Mark is a very high functioning student. He's a kindergartner. He's 6 years old. He has Autism Spectrum Disorders, and his favorite activity is reading because he has been reading since the age of 3. And he was particularly fascinated, as it happened in this case, in space exploration. And he always liked to choose the book center and liked to pick up a book and read, and he was very fond of space books. And what happened in this particular situation was his classroom furniture was moved, was suddenly rearranged, and the book center was different from where he left the previous afternoon from his classroom. And Mark got so very, very agitated that the next morning when he came into school and he found that the book center was not where it usually is, he started throwing books and blocks and chairs, and it was just absolute chaos. It was scary for the other kids. Yes, it was scary for the teacher. And from Mark's perspective, his world had changed, and he didn't know what to expect. And he was very anxious and scared. So a few things ahead of time could have helped Mark to prepare for this change. If he had been prepared, primed a week before with a picture, with a photograph, and these days that becomes very simple with our smartphones, if they had taken a photo of that book center and placed it in the new location where it was going to be, and every day Mark told, listen, this book center is going to be here. See this photo? That's where it is going to be. And if he had been prepared, and also in addition to that, the afternoon before it was going to be moved, so that when he comes in, let's say it happened on a Tuesday afternoon, when he came back on Wednesday morning, he knew something was going to change, and he would have been better prepared for that change. It's a simple change. And since this advanced preparation didn't happen, Mark threw a very big tantrum. Yes, it was scary, and unfortunately in this particular case, this is based on a real case situation, the consequences that happened to him were certainly not positive. An advanced preparation, because they knew he's high functioning, he would understand the photo, and he should have been prepared, and that did not happen. One of the things, in addition to structure, in addition to advanced preparation, one of the techniques and strategies that helps children with autism is using music as a calming tool. When it is consistently used, researchers found that it helps children with autism in handling changes, and it has multiple benefits for them. First and foremost, all of us know that music has a calming effect, and it does for children with autism too. And if you use music, especially between changes, between activities, it kind of has a kind of a predictability to the routine. And it helps that child to be more independent in completing the routine. It kind of lowers the anxiety level and the frustration level for the child. And the child is better able to focus and engage in the next activity if music is used to make the transition. And of course, another thing that the researchers found is that it also increases interaction, social interaction with peers. One of the things a music therapist and I have put together, it's a CD, a music CD. It's called Magical Musical Transitions. It is sold by NPR, not National Public Radio, it's the NPR, National Professional Resources. And these are songs, multiple songlets, I would call it. These are mini, mini songs, and it has every songlet has a brief introduction, how to use it, and variety of transition that takes place in the preschool setting, kindergarten, and maybe even first and second grade. For children with autism, you can use these songs. And they are designed with the application of music therapy. It was a music therapist who is also singing the songs, and we work together on this project. And these are all piggyback songs from traditional routines, but it has key words that address the particular transition. I am hoping to share now one of the songlets, and I'm hoping it's going to work, and I'm hoping you will hear. If you don't hear clearly, I apologize, but I'm going to try my best, and we are going to try our best. And it's with just a very short thing. I won't be speaking because I'll be putting the phone next to my computer.
Use this songlet to transition from circle to centers so the children make choices. Be sure to provide pictures of choices available for center activities. Limit the number of choices to facilitate easy choice making. Insert the child's name in the blanks. Circle time is over. Now it's time for center. Child's name, show me which center that you choose. Choose your center. Choose your center. Show me which center that you choose.
I hope you heard that. Just kind of a sample song to see what you can do. You can use this particular music CD, or you can create your own little songlets to help your children make the transition from circle time to center time. And another example, not only for using music, but another example, another case scenario of a child having issues, and many of you may face such issues. And this particular teacher shared with me and said, when we walk into the classroom every morning from the bus, Alan screams all the way, and he screams all the way, and he refuses to settle down even when we come into the classroom. This is what the teacher said. So one of the things that you can do, certainly, is to have music to kind of greet him from the bus to the classroom, assuming he comes on a bus. And or you can take a favorite toy of his and kind of give it to him, and he walks back with that toy. Or you can program a Big Mac with that song, just a couple of lines of the song, and I'm going to share with you that song too, and kind of ease that transition so that he is calm. And then later on, when he's actually not perturbed, not anxious, you can go over the rules of walking from the bus to the classroom, and you can pair it with some picture rule cards. And once he is in the classroom, there are certain steps you can take. For example, you walk to the bus with his photo match with his name card, and he goes and matches it with his backpack, and next to his backpack there is his photo and name card, and then also on the mat that he sits in the circle time, he also has his photo and name card, and so that he follows that same structured routine. Now I am going to go ahead and play this song. This one is called Welcome to School Today. So it also
signal that recess time is over. It is recommended to provide an advance warning to children prior to the end of recess. Ring a handbell or use finger symbols to draw children's attention.
I apologize. I know it was moving on to the next one. Also, it's one of the suggestions that I have is try to combine it with assistive technology tools to program it so that finally you can have the child press the device, activate the device, and play the music to help himself or herself to calm down. And we all know that children with autism do have a certain fascination for technology. And one of the things that I mentioned previously was kind of having Alan's name on his mat, and he has a specific place. If he is sitting on the floor, on the carpet, he has a specific place and a specific mat, and that's his space, and that kind of assures him that he will have the same space. And the same thing you can do at the table, and later on I will be talking about personal space. Another child, Brian, he's a 5-year-old in a preschool classroom, and he runs out of the classroom. Whenever the classroom has some kind of center activities, he starts moving away from the centers and starts running, and he wants to run out the door. As I mentioned previously, one of the contributing factors for children with autism, when they are in a somewhat unstructured setting, they often are more fearful and anxious, and they may not respond appropriately, even though they may have experienced centers many times. So one of the first things that you can do is to kind of post a stop sign. And this is one thing that has worked, because as I go into classrooms, visit classrooms and provide consulting, this particular one and a few others that I shared with you already were effective. Post a stop sign at the door and use the stop sign to remind Brian that when he sees that sign, he has to stop, he has to turn around, and he has to go back to his chair or the mat on the floor. One of the things that will help, in addition to posting the stop sign, is having pictured cue cards to remind Brian. And when Brian is not in the running mode or running out of the classroom mode, you can go over the rules of when he's in the centers and he feels like running, he has to ask for a break, and he can go to the safe space in the classroom, take a break for 3 minutes, and come back and join, but he has to go and ask an adult for help. First, the most important thing, of course, is to teach him how to respect that stop sign at the door whenever he feels like running out of the classroom. Another situation. Jose, when he sees an open space, he starts running around or falls on the floor and starts rolling on the floor. Again, I mentioned earlier on that make sure you arrange the furniture to prevent large open spaces. One of the things that you can do is, especially if you happen to have another adult helping you, maybe a paraeducator, is to kind of watch for those rumbling behaviors. Those rumbling behaviors occur usually before a kind of a tantrum or a meltdown or rolling on the floor. Watch for fidgetiness. Watch for restlessness. Watch for the child trying to move away and getting distracted and looking here and there. Or increased stereotypical behaviors, that is repetitive behaviors, and lack of interest in the activity or the centers that he or she is working with. Or maybe you're working at a table and the child is not focusing attention on the activity that you are sharing. So these are things to watch for so that you can say, Brian or Jose, you need a break? Take a break and give him the break card. And if you have taught him how to use the break card and go take a break for a few minutes, that would help him in this situation. And when the child is calm, you go over the rules and how he should ask for help and what to do when he feels restless. And the other thing, of course, is a very simple thing, and to teach him when he is calm, when Jose is calm, how to count to 10 and to calm himself down. And of course, the support tools or visual supports you need the break card to request a break, and always the text is paired with the pictures. We have been seeing mostly boys having problem behaviors. As you know, 4 out of 5 children with autism happen to be boys, but there are also some girls who have some problem behaviors. And whenever we come back to the classroom, in this particular situation, from recess or assembly, Sarah throws a fit. She refuses to follow direction and starts pinching and scratching us when we try to get back into the classroom and get her to walk with us back to the classroom. This is what the teacher reported. Again, advanced preparation. Make sure you have some pictured rules as well as make some advanced preparation while you are out there in the playground. Let's say 5 minutes before the recess is up, you give a kind of an alert signal saying in 5 minutes, and this is a good time to kind of use a musical instrument instead of a bell. And one of the things that I recommend is what is called, you will see that in the next slide, it's called a stir xylophone, and you can play that. And then again, about 2 minutes before, you play the same musical instrument to say, we are going to be lining up, and make sure the second time or even the first time, you make sure you take that instrument and you position yourself close to that child who usually, that is in this particular case, it happens to be Sarah, and you play that instrument so that it kind of triggers in her memory, oh, this is time for us to line up and go back to the classroom. In addition to that, of course, you have to have a visual schedule that shows the activity that's going to be over. In other words, you have a picture of the recess with the playground picture, putting with an X on it, and you have it pre-prepared, and you always take it to the playground. And then you have a picture of the activity that is going to come. For a child who is high functioning, maybe he could have a folder and he could have these pictures, and with some adult guidance, he can maybe change those pictures from the activity that is over to the activity that's going to come up. So, and as soon as the child has responded and lined up, praise the child, and one of the things that you can do is the child can carry that. In this particular case, I mentioned stir xylophone, can carry that, or if the child has another preferred item, the child can carry it back to the classroom so that the hand is busy with that object and not focused on crying or a hand that reaches out and hurts others. As I said, you can play a musical instrument, the stir xylophone, and you have to get her attention. One of the songs that you can use is a song that says recess is over. And when you play that song, it's a reminder. And again, you can use that, or you can use the suggestion that I suggested, and different children respond differently. Some may not pay any attention to the musical instrument, so some may better respond to music. So do have a variety of options and see which one works. Again, I am going to play that song. It's called Recess is Over.
Songlet to signal that recess time is over. It is recommended to provide an advance warning to children prior to the end of recess. Ring a handbell or use finger symbols to draw children's attention. Since this songlet will be used outside, it will be helpful to memorize the words or play it from a recorded tape or other portable voice output device. Recess is over. Recess is over. Line up now. Line up now. Time to go inside. Time to go inside. Line up now. Line up now. Recess is over. Recess is over. Line up now. Line up now. Time to go inside. Time to go inside. Line up now. Line up now.
Hello, I'm back again. And music is a good technique to use, songs, mini songs, to help children not only to calm down, but it serves as an advance warning and advance preparation and makes the transition to the next activity smoother. In this particular situation, this is another case scenario about a young child by the name of Amina. And when she is working either as part of a circle time on her mat, or when she is at a table, she reaches and touches other children, and occasionally the other children say she is scratching them, but Amina doesn't clearly understand what she is doing, but somehow even when she is reaching out, the other children get scared. So what is something that can be done to help Amina? One of the first things that you can do is to teach her personal space. And how does this personal space work? In other words, first of all, you create a kind of a square using masking tape and teach her that's her space, and at the same time show her how to use two arm lengths the arm lengths in front of her to say that's the space that she can use, and she cannot go beyond that space in reaching and touching others. In addition, of course, you have to teach her what she can do with her hands, and it may be helpful, if, in the beginning at least, to give her some kind of finger puppet or something to hold in her hand that will serve as a kind of a distraction for her from reaching out and touching others. In addition, I'm sure many of you have heard of social stories, and one of the things that you will find that's helpful, it's called scripted stories, and I have the website address where they have examples of scripted stories in this presentation, and I have the website address, and you can use a scripted story or a social narrative is the other term that's being used to teach Amina and how to keep her hands to herself, and about feelings of others when she reaches and touches them, and how they get scared, and how she should kind of show responsibility and respect for others. So a simple social story will help, and you go over the social story just before circle time every day to remind her until it becomes second nature and she is able to stay within her personal space. Another child, this is Sophia, somewhat similar problem, and she grabs toys and blocks from her peers seated near her, and when the paraeducator tries to stop her, she tries to pinch or bite. Again, just like we saw in the case of Mark, Sophia who threw all the furniture and chairs in the classroom because to him his world had changed. In the case of Sophia, she doesn't realize that the toys belong to someone else, and again due to the fact that Sophia, because of her autism, has issues with her social interaction, understanding the feelings and emotions of others, and she thinks of everything as something belonging to her. So when the paraeducator tries to stop her, she responds in a very negative manner. So again, for Sophia, she has to learn her personal space. What is within her personal space, she can use. The toys within her personal space, she can use, but she cannot reach beyond and think. So it is difficult to correct her at that time when it happens. Maybe this is a time for her to go and take a break, and when she is calm, you can teach her the use of the personal space and kind of drawing a boundary around her desk with duct tape or masking tape and showing her how to stay within her space, and taking a photograph of the personal space with the arms outstretched in front of her and clasped together, and show her the photo when you are teaching her. And model it with gestures so that she will remember, and she may need multiple reminders and constant teaching. This would be the behavior, and the new skill that she will be teaching. And the preventive strategy is to put that duct tape and create that personal space. So as I shared with you, for both Amina and Sophia is teaching personal space as well as use of scripted stories so that they learn how other children feel. One of the things that children with autism need deliberate and planned teaching is to learn about feelings and feelings of others and emotions and the different words that describe emotions. So that would be helpful. You can use some stories to teach about emotions and how others feel when you touch them, when you grab their toys, or when you pinch them or scratch them. And about different kinds of feelings, as I have mentioned there, they get frightened, scared, hurt, sad, and pair them with visuals. And you can also use a story, a beautiful story about feelings. It's called On Monday When It Rained. It's a preschool picture book. On Monday When It Rained, shows different kinds of feelings, and that's a helpful tool, and you can use that in combination with your scripted stories. There are two websites that are portrayed here. That one is the CSCFEL, Vanderbilt .edu, that has a lot of preschool scenarios and preschool strategies, and then social narratives provided by the Autism Internet modules. In closing, I do want to mention, I don't mean to go over, but I do think it's important. for families, for you to share with families, and if there are families participating in these webinars, one of the problems many families feel is when they take their child to the grocery store or to the restaurant or to the dentist office, frequently they have to experience the tantrum of the child. What are some things that families can do that you can share with them, or families who are participating can get some ideas? Choose times to go to the grocery store or restaurants or to the mall at a time when it is least crowded so that the environment is not overwhelming. By the way, this helps even with the cafeteria in the school. And make sure you have a kind of an advance warning that you provide in what order the activities are going to take place as you go out. And as you go into the mall or go into the grocery store, your child has a tantrum. Instead of trying to discipline your child at that time, it may not work at all. Once your child has entered that kind of a rage mode, it's best to leave that shopping, leave the mall, and go back to your car. If I'm assuming you drove there, then put the child in your car seat and help the child to calm down, and then try back again. But one other suggestion that I have is if you can buy yourself a small photo album. Usually it's available in Michael's for even $1 or $2. And create photographs of, take photographs when you go to the store, grocery store, of some of the aisles that you will, and say before you step into that grocery store, as you leave your car, show your child the pictures, the photographs from what you're going to be doing. That prepares your child. The same thing you can do whether it is the restaurant. Say, what are you going to do? You're going to have to wait, and then the waiting time, show the picture of your family waiting at a table. Take the photograph, put it in the photo album, and share it with your child to provide advanced preparation. This will prevent a lot of the tantrums. And again, in summarizing, if you see some of these behaviors, crying, screaming, hitting, kicking, or biting, do put in place preventive. Make sure your structure is supportive to the child. Ensure there is predictability in your environment. Prepare in advance to prevent meltdown. Watch for rumbling behaviors and restlessness, and give the child an opportunity to take a break. And most important, how adults respond to that behavior is important, because sometimes through our reaction, we may be aggravating and intensifying that meltdown. And again, what are some personal interventions that I have shared with you? Flexibility. You ask the child to clean up, and the child usually ends up with a tantrum. Maybe you can provide a peer, and the children can take turns, or the adult can put one block in, and the child puts one block in, and they take turns. And instead of kind of punishing the child for not cleaning up, we come up with a support system, structured breaks, using music to assist with transition, using scripted stories to teach social skills and socially appropriate behavior, and finally, we want the child to learn problem-solving skills himself, so we teach replacement behaviors. And with picture support, we can remind the child what behaviors he should be demonstrating in that particular setting. And first of all, I want to say thank you to AbleNet for offering this webinar, and I wanted to share with you a couple of webinars that may be of interest to both paraeducators as well as preschool teachers. One of them you can register at the AbleNet webinar registration site. It's coming up on June 16th. It's delivering effective paraeducator support to students with disabilities, how it should be carefully choreographed, and it's really a delicate dance so that it is not over-prompting or over-intense support. The other one that should be of interest to preschool teachers or preschool coordinators would be focusing on building the brain when it counts, nurturing social emotional domain with positive behavioral approaches. It will be using a number of preschool picture books to demonstrate the strategies. And thank you very much to everyone who participated in this webinar. I hope you are walking away with some helpful strategies. And again, thank you to AbleNet for enabling this webinar to take place. Thank you and have a great day.